Hello everyone, I am Dr. Aniket Vijay, Consultant Interventional Cardiologist at ASHRAYA Heart Institute, Ashraya Hospital, Chikmagalur. When we started the cath lab facility and full-fledged cardiac facilities a few years back in Chikmagalur, we faced a unique kind of problem. We used to receive patients with heart attack, but with a delayed presentation. When I say delayed, we used to receive patients with onset of chest pain more than 12 hours after the onset of chest pain, more than 24 hours after the onset of chest pain, or sometimes more than 48 hours after the onset of chest pain. So though we received patients with heart attack, it used to be with a delayed presentation. They used to have already the heart muscle would have been damaged, the ejection fraction would have been low, they would have been in cardiogenic shock, and they would have been in heart failure. So even though we performed procedures in them, the benefits of the procedure would not be availed to them. This is mainly because of the delayed presentation where the heart muscle would have been damaged. The golden hour, what we say is less than 4 hours, was missed in these patients. So the mortality drastically increases in them whenever they have a delayed presentation and when the ejection fraction goes low. And we found out that in rural areas there were no ECG facilities, there was no proper interpretation of the ECG. Because there was no ECG facility and there was no proper interpretation, we had a delayed presentation to the cath lab. Because of all these reasons, we used to receive patients in a very deteriorated state, in a very sick state, and they used to be in cardiogenic shock. And this is how we had increased mortality among these subset of patients. As a result of this, we decided to come up with a solution in association with GenWorks, and we called it as ASHRAYA Heart Connect. In ASHRAYA Heart Connect, we distributed from Ashraya Hospital free ECG machines to all of the rural areas, and we instructed the local doctors to use these machines. So any patient with a chest pain goes to these centers, immediately an ECG is taken. Within seconds, the ECG comes to our dedicated ECG hub station, which has a dedicated 24 hours team to report the ECG, and the ECG also comes to my mobile. The interpretation of the ECG is done by me, and suppose I am busy or withheld in a procedure, then the interpretation is done by my dedicated ECG team in a hub station 24/7. In spite of them also, supposedly they are busy, then the reporting is done by the GenWorks dedicated ECG team, where they send the report to us as well as to the local doctor. In this ASHRAYA Heart Connect program, if there is a critical ECG or if it's an acute myocardial infarction, we interpret the ECG within seconds. We ask the local doctors to send the patient immediately within the golden hour of 4 hours. Meanwhile, we keep our casualty and the cath lab facility ready to receive the patient. In this way, we are able to cut short the mortality in a significant way, and we are able to reduce the delayed presentations. ASHRAYA Heart Connect in the last few years has been able to save many lives by this program. Thank you.